Thank you very much for coming. As you know, today President Obama is going to outline a new proposal for comprehensive health care reform, and it's going to include some of the ideas presented by Republicans at the bipartisan summit. And obviously we all are hopeful it's a positive step, and we must pass comprehensive health care reform that makes health care accessible to all Americans, affordable to all Americans, and affordable for our businesses. But as the White House moves forward with comprehensive health care reform, we can take incremental but consequential steps that will provide immediate help to Americans, individuals, families, and businesses. Last week, the House overwhelmingly, in a bipartisan way, eliminated the antitrust exemption for insurance companies, something that has led to very high prices for our consumers. This week, we have a group of 60 House members, bipartisan, that wants to pass legislation that would require price negotiation with the prescription drug companies. It's a common sense step to take. The Medicare Prescription Drug Price Negotiation Act of 2010 would do the following. Number one, recognize the taxpayers right now are on the hook for paying over $50 billion in purchases of drugs in the Medicare Part D program. Yet, even though Congress and the American taxpayer is buying wholesale, it's paying retail, all because the Congress previously prohibited price negotiation when you're doing wholesale or bulk purchasing. It makes absolutely no sense. And the point of our legislation is to give the benefit to the taxpayer as a wholesale purchaser to get a negotiated price. We have that in the Veterans Administration program. And if we had the same approach in the Medicare prescription drug plan, we could save over 10 years $156 billion for the American taxpayer. We have a chart here that just shows what the difference is in prices. Nexium, Part D, non-negotiated, $1,433 versus $848. And you can see these, so I won't read them all, but just go to that last one, Zocor. Wholesale price, or retail price, non-negotiated, dictated by the prescription drug company, $1,486. The VA negotiated price, $127. There's no justification whatsoever to rip off the American taxpayer, make them pay retail when we're purchasing wholesale. Our bipartisan group wants to bring down the cost of health care. That is the major impediment to access to our families and affordability for our businesses. The drug companies are doing fine under the status quo. Between October 08 and November 09, brand name drug prices went up 9.3%, despite the fact that there was almost zero inflation in the economy. Specialty drugs went up 10.3%. In that same year, pharmaceutical profits jumped to $51 billion. So today, all of us here, and many who are not, but have co-sponsored the legislation with us, want to restore market forces to the purchase of drugs. Makes sense. We have a bipartisan group, and we're led by many folks here who've been working on this issue in their own right and together for years. And I want to first introduce Representative Jane Harman of California, who's a senior member of the Energy and Commerce Committee and has been a leader not just on this issue, but anything about trying to make drugs in medical care more affordable for all Americans.